today to see Jamie, who wants to learn about CoolSculpting.
Hi, Dr. Hughes. I guess some of my questions with CoolSculpting is I'm a mother of 3. I work full time. I definitely want something for my problem areas. Not quite ready for liposuction just because I don't have the downtime right now and I kind of want a quick fix. So I have a few questions I was hoping you could answer for me. I guess my first question is, does it hurt?
Well, Jane, have you had a mammogram before?
I have.
So, the guys can't quite relate to this, but the area that, say it was your upper abdomen that bothered you, we would place the tube on your tummy, on your bare skin, with a protective cover on it. It sucks the fat into the tube. It's going to squeeze hard for a couple minutes. And it's also going to cool it at the same time. So the cool makes you numb. So all of a sudden you sit there and go, now what? Well, you sit there, you read your Kindle, you read a magazine, listen to your music. And after 45 minutes, we turn the vacuum off, remove the head, and you look down. And you say, that wasn't too bad, but when is this pink lump of hard fat going to go away, my little pink baguette? We then massage it, and within 5 minutes, it's flat, and within an hour, the little pink discoloration is gone. The chill goes out of your skin. You go home to your family, nobody knows you had it done. You're not in pain. I'm like, that was easy.
Well, it does seem easy. Wait, so can I fit my whole body in the head? No, I guess my next question is, I mean, I'm interested in my upper and my lower abs, so I'm curious, will that fat go somewhere else, or will it be gone forever? How does that work?
You will lose 20 to 25% of your fat. Gone, just like liposuction. However, just like liposuction, if you gain more weight, it's going to go someplace else. It's usually pretty well distributed. It goes to the breasts, the arms, the legs. It's pretty much all over that you get some extra fat, which is nice in a way. So if you did your upper abdomen and you came back and you did your lower abdomen in a separate session, or even at the same session, you'd even see a bigger reduction. Some people really like it, but it's not as effective as liposuction. But you will see a nice result. It's safe, it's painless, it's easy.
And you have to maintain a healthy weight and exercise, and still, this doesn't let you go hog wild. It's,
absolutely not.
Okay, and I guess after I get this done, am I able to go right back out? Can I take the kids around? Can I go out to dinner? Will anybody know? Do I have any restrictions?
Drink a lot of fluid and have a good time. Relax. You did it. It's done. You just can't expect to see the result right away. It takes time. It takes a couple months, and all of a sudden you go, oh, clothes are fitting better. Oh, I can move better.
And I guess that's what I want to see. I mean, I understand that the pounds won't change on the scale, but how I feel in my clothes, I think that's huge. You don't want to have that pooch or that muffin top on the top of your jeans. I mean, that's just not a good look. So I think this is why this is a great option for me. With my time and the children and work, I really think this is probably, a great fit for my lifestyle.
Especially for this time.
Yes, if you would agree.
I just don't want people thinking they're going to have their Zeltique done and then they can fit into their dress that Saturday night. It's not like automatic.
Well, I'll give you 3 months.
Okay.
Good idea. So, Dr. Hughes, do I need to steal my husband's Amex for this thing, or what are we looking cost-wise for me?
Well, the cost depends on the area that bothers you and the patient's size. So if it was me having liposuction done and I wanted to get rid of my middle-aged bra fat, I would use 2 small heads. But for you, having told me already that you want to get your top and bottom tummy melted, we would have you do 2 sessions, one of your upper tummy with the larger head and one for the lower tummy with the large head. So you'd pay more. You'd pay twice as much as somebody that was getting 2 small heads.
But that would give me my optimal result too. I don't want to have my top be smaller than my bottom. I want to have a nice treatment.
Nice evenness. Yeah,
right.
That's a good solution for you.
Okay. I also have a sister who's very slender. She actually just has a little bit of, I guess, a little muffin top. Now, obviously, her pricing would not be my pricing.
Right.
Because there's different heads.
Hers would be about half that price.
Okay. I think that's fair.
A lot of men come in to get their flanks done. They don't want to have liposuction. They're busy. They're on the go. They don't have a lot of time. They'll come in an hour they'll get one side, in an hour get the other side. They can go right back to work without any worries, and it's done. But as long as they know they have to wait a couple months.
And I guess with how it works, I'm just hoping it's like bippity boppity boo, but I'm sure there is science behind it. Could you kind of give me the dummies terms on how this actually works?
It's a great story. In the 70s, pediatricians noticed that kids' cheeks would cave in. Their mothers would be all, what happened here? And they discovered that kids would suck on a popsicle in one place, and a couple of weeks later, their cheek would be caved in. But because kids have a lot of stem cells, it would go away, and they figured it was popsicle paniculitis. We're older. We don't have stem cells like that. So if we do liposuction in an area, it sucks it all out. But if you do certain pocket problem areas, or you just want some reduction with the CoolSculpting, you can do it by freezing it. It takes time, just like it did in the kids. It takes time for the cells to die and be processed out by our bodies.
So when it's processed out, does it through your normal, you sweat?
It goes through your lymphatics. It comes out through your urine. It's
as long as I don't see big fat cells, I think I'll be fine.
Yeah.